Okay, so ready na? Kay mag-start na ta og mga antidepressant drugs since pharmacology manina subject, meaning it is very important na you will understand how our drug for depression works, and it is also important that you will be able to identify the different antidepressant drugs, especially on what group they belong. So, what is the mechanism of action of our antidepressant drugs? So most of them, either they stimulate they stimulate either directly or indirectly the actions of the two important neurotransmitters we have identified yesterday in the pathophysiology of depression. So, di ba, when we talked about the pathophysiology of depression, though you have mentioned na it can be because of hormones, or it can be because of neurotrophic na mga factors, but most of our drugs are really into the neurotransmitters. So they are either a direct agonist or an indirect agonist to the norepinephrine and serotonin na mga actions sa brain. So this is specific sa brain ha, kasi our depression is nag-originate siya sa work sa mga neurotransmitters sa atoang brain. Okay? So kailangan i-potentiate ang activity ani ni norepinephrine and ni serotonin. Kasi when you have depression, you lack either or both of these neurotransmitters aside from the hormones that we identified yesterday and the factors also. So let's move on to the first group of antidepressants. So the first group is called SSRIs, or we call this selective serotonin reuptake inhibitor. Again, SSRI means selective serotonin reuptake inhibitors. So who here can remember what reuptake means? Sa meaning sa reuptake, class? Diba, na-mention natin na when we discuss norepinephrine? Yeah, mubalik. Tama, Sarah. Asa mubalik?
Mubalik siya sa sulod, ma'am.
Okay, very good. Ibalik siya sa sulod sa cell. Remember that our neurotransmitters are produced or synthesized inside our neurons or our nerve cells. And for them to be able to take their action, they have to bind to their receptors, but it's outside the cell. So kailangan i-release. But in our body, meron tayong tinatawag na reuptake, which means that the neurotransmitters being released can be taken back inside the cell. And once na mabalik sila inside the cell, they can no longer bind to their receptors. Thus, they will not take their action. Instead, we have enzymes inside our cell that can degrade this neurotransmitters. Okay? So again, asa ibalik atong neurotransmitters, it will be inside the cell. So the reuptake is not just for norepinephrine alone, but serotonin also. So the released serotonin from our neurons can be taken up inside through the SERT. We call it SERT, serotonin reuptake transporter. Kaya di ba ang norepinephrine, we call it NET, or the norepinephrine transporter. So since this is selective serotonin reuptake inhibitor, then these drugs, ang mechanism of action nila is they will be inhibiting the serotonin reuptake transporter para hindi mabalik si serotonin inside, and mutaas ang chance, ang possibility na this serotonins being released will be able to bind sa mga receptors available. Now, they are called selective serotonin. Selective sila for serotonin. They are 300 to 3,000 fold na greater ang selectivity to serotonin compared to norepinephrine transporter. So we call them SSRI, and for depression and for other conditions, actually SSRIs are the most widely used agents. However, though they are the most widely used agent for depression, ang mga agents na ito, aside from the inhibition sa SERT, they can also block other receptors na pwedeng maging dahilan sa kanilang adverse effects. So just like this one, SSRIs can be able to block the muscarinic receptors. So aside from being an antidepressant, these drugs can also be called anti-muscarinic. And I hope you can still remember the effects of anti-muscarinic. Remember, pag muscarinic, it's cholinergic. And when you say cholinergic, we are talking about dumbbells. But since this is blocking the activity of the muscarinic receptor, then you just have to reverse the dumbbells, and then you will be able to identify the effects of SSRI. So when these drugs block the activity of muscarinic receptors class, this will explain some of the adverse effects of the drug. So later we will be identifying them. And then aside from that, aside from blocking the muscarinic receptors or the receptors of acetylcholine, SSRIs can also block the alpha adrenergic receptor. So kompleto siya class, both sympathetic and parasympathetic na mga receptors kaya i-block sa SSRIs. And at the same time, antihistamine po siya. So kaya po i-block ni SSRI ang atuang mga histaminic or H1 receptors. So we have two types of histamine receptors, the H1 and the H2. H1 is responsible for allergy, and H2 is responsible for the release of our gastric acid. So this time it's H1, meaning it's more on the allergen side, but the ability of the SSRIs to block the histaminic receptors will result to its adverse effect, which is sedation. So remember na atong mga antihistamine or ato ang mga anti-allergy, most of them are sedatives, kanang makatulog ka. So this will explain the reason why if a person is taking SSRI, normal nga magsige siya katulog because of the activities of these drugs to these receptors, aside from the major mechanism of action, which is the inhibition of the serotonin reuptake. So what are these drugs? I told you na we cannot really simplify. I mean, dili sila the same og ending sa ilahang mga names. So dili pareha sa mga beta blockers, at when we say olol, automatic beta blocker na to. Pag-abot sa antidepressants, wala sila yung similarity when it comes to their names. That is why medyo you will take a lot of effort to memorize the groupings of our antidepressants. Okay? So what are these? When you say SSRIs, we have the citalopram, the escitalopram. You can encounter them when you have your internship, both in community and hospital. You can also see this community, but since this one is an antidepressant drug, it's a prescription drug, basically, definitely. So you can see this inside the dangerous drug nga cabinet sa pharmacy. So walay laing pwede mag-open ana nga cabinet, pharmacist lang. So pharmacist lang pod ang dapat mag-dispense ani ng mga drugs. So we have fluoxetine, fluvoxamine, paroxetine, and sertraline. Okay? In what case, Isobel, nagisabay ang anticonvulsant sa SSRI? What's the case of the patient? Yeah, lamotrigine and escitalopram. What's the case of the patient? Bipolar. Yeah, you can do that. You can do that. Anyway, we'll discuss anticonvulsants also and other drugs na pwede gamiton for bipolar disease. Kasi sometimes you really need to have more drugs para maiwasan ang pag-shift sa patient from the manic phase to the depressive phase and vice versa. And anyway, anticonvulsants, later malisdan ko mag-explain if dili ta mag-concentrate with the anticonvulsants. Mga next na mga chapters, maybe in the finals, we'll have that. Pero is that being prescribed by the physician? Kanang lain nga ginapalit kung walay lamotrigine. Yeah, the physician, the psychiatrist. Unsa man tong lain nga ginapalit kung walay lamotrigine? Nga nung ginapalit man to, is that prescribed by the physician? Yeah, if that's prescribed by the physician, then the physician is the one nga very knowledgeable sa condition sa patient. So, mo na iyahang ginagamit. Okay? So anyway, this one are the SSRI. If you have watched the movie Love and Other Drugs, it's about a person having Parkinson's disease. Nakakita mo na Love and Other Drugs. I saw that movie when I was a student. When I had my manufacturing internship sa Manila, ako na siya nakitaan. Nagtanaw ako mga classmates, so nakitanaw lang po ko. You can see their drugs for Parkinson's at the same time for depression kasi nag-depression po ang patient ato because she was a painter. And then after that, she was diagnosed with Parkinson's. So since remember, Parkinson's have tremor and muscle rigidity, dili na siya pwede mag-paint. So nagkaroon siya ng depression. And gihatag ni sa iyaha ng mga tambal. And I think ang lalaki dito is a medical representative, a medrep of, if I'm not mistaken, it's either the Zoloft or the Prozac. So you can encounter these drugs sa Love and Other Drugs. Okay lang to siya nga movie. It's just that daghan lang dito siya og kanang scene nga bed scenes. Okay. Daghan lang to siya bed scenes. Mo lang to ang dili maayo nga side dito na movie. But you can encounter these drugs. The sertraline and the Prozac, I think. Okay? Ngano to sila na mention kasi medrep ang lalaki. But these two, the Prozac and the Zoloft, are different companies ito siya. So meaning they are competitors. Competitors sila. Pero yes, Prozac and the Zoloft are the two very widely used SSRI, especially for depression. Okay? Questions, class? About these drugs? So the next time, class, you will encounter these names of the drugs, you have to know that these are for depression and they are specific for the inhibition of the reuptake of our serotonin. Okay? So, ang ending ana, since na inhibit ang reuptake sa serotonin, you will have more serotonin that is available for binding and pwede mag-take og action sa body. Okay? So again, mechanism of action blocks the reuptake of serotonin, leading to the increase of concentrations of the neurotransmitter in the synaptic cleft. So, on what condition can we use the SSRIs? So, syempre, since this is an antidepressant, number one indication is depression. Okay, so very good question, Belly. Ano ang mangyari pag masobrahan ng serotonin? Later, we will also encounter the condition called serotonin syndrome. That will be the condition na mag-result if you have too much serotonin in the body. Again, we call it serotonin syndrome. And then we will discuss later what happens to a person if magkaroon siya og serotonin syndrome. Okay? So aside from that, the SSRIs, aside from giving this to patients with depression, we can also give this to anxiety disorders. Again, pwede sila ihatag for anxiety disorders. So unsa ang kanang anxiety class, klase-klase na siya. So we have different types of anxiety. It can be obsessive compulsive disorder or OCD. OCD is a type of anxiety. Are you familiar of the OCD, obsessive compulsive disorder? Do you have idea what? Syempre, ang depression human na taog discuss. But let's discuss shallow discussion only of some types of OCD. Anxieties. Any idea about obsessive compulsive disorder? Wala. OCD? Mga OC. Say nabalaan ninyo about sa ila. Possessive? Aside from that, what else? May ano ni siya? May two like phases or conditions para ma-fulfill na ang person is having OCD. First is the obsession and second is the compulsion. So when you say obsessive compulsive disorder, this is class an anxiety disorder wherein the person has an obsession of doing a thing repetitively. Meaning, paulit-ulit niya na siya ginahimo. And then there is compulsion. When you say compulsion, ang meaning kailangan niya na buhaton, kay pag dili na niya buhaton, magkaroon siya og anxiety na signs and symptoms. Okay? That's OCD. So, for example, by the way, naay mga OC pero dili disorder ha. Obsessive compulsive lang sila pero dili siya disorder. Mahimo lang ni siya disorder kapag naka-cause na siya na maapektuhan na ang day-to-day life sa person and maapektuhan na pod ang mga people around him or her. So, for example, kanang obsessive compulsive na behavior lang ha dili disorder. So, for example, kana bitang natulog na ka pero your obsession is dapat before ka matulog na check na nimo kung nalock na ba inyong gate. And then your compulsion is imuha gyud na siyang himuon nga i-check nimo kung nalock na ba ang gate. Kay pag dili nimo na siya himuon, since you are an OC, dili ka katulog. There will be anxiety. Okay? So, mo na siya ang mga persons with OC, obsessive compulsive na behavior. Pag nasobrahan na siya, nga it can interfere with the day-to-day life of the person, it will become a disorder. So, naiuban nga masigsilag pang alcohol, na dry na ilahang kamot, kay feeling nila makatouch lang sila og something, hugaw na kaayo ang ilahang kamot. So, ang compulsion is kailangan magsigid sila og pang-alcohol. And paano na siya naging harmful sa ilaha? Alcohol is good. It's a good antiseptic, but too much use of alcohol sa skin can cause dryness. Okay? So, naay mga OC na behavior, but if nahimo na siyang harmful to the person and to the people sa iyahang palibot, mahimo na siyang disorder. So, that's one type of anxiety disorder. Wala ko kita na nga palabas. True beauty. Sige siya panghugas sa iyang kamot pag masuko. Basta na ganin na obsession tapos compulsion, meaning kailangan yun niya himuon, OC na siya. Okay? Kaya mag-anxiety man na siya, basta dili niya himuon. What else? What happened to people with anxiety? Ano na sila, ilahang brain is very active. And when it comes to the pathophysiology, if we look at the pathophysiology, there is increased norepinephrine. That is why their brain is very active, but they have decreased serotonin and they have decreased GABA. That's why we can use SSRI for people having anxiety disorder so that we can increase the level of serotonin sa mga patient nani. Okay? So that's the first type of anxiety, the OCD. The second one is the panic disorder. So kanang may mga panic attacks gani class na bigla-bigla na lang there will be signs and symptoms of anxiety, maglisod na siya og ginhawa, tapos usahay kay there will be loss of consciousness, daghang klaseng mga signs and symptoms nga ma-experience sa person having panic disorder. So mukalit lang na siya og attack ilahang panic I mean ilahang panic attacks. So wala ko'y panic disorder pero there will be times in our life na ma-experience nato na siya. So ako dili makalimtan ani is tung na ako sa Manila, the last time I was the CI for manufacturing internship, that was 2019, na nagsakay ko bus. Gikan kog Laguna, nagbisita ko sa mga interns sa Laguna, and then pauli ko og Manila. So nagbus ko, and then malagot manggug ko sa bus gud sa Manila kay kanang siksikan bitaw, hangtod na apay space, daskan pa na siya og tao. So naglingkod ko, pagsakay na ako, wala na yung laing bakante ang sa likod ng chair. So naapay lingkuranan. So nilingkod ko dito, tapos wala pa nilarga ang bus, lagi puno ang mga nagatindog na mga tao. Tung nagalarga na siya, na mi sa skyway, kanang feeling ako dili na ko makaginhawa. Kanang feeling na ko kung magkinaunsa kay di ko dayon makagawas gani sa bus kay grabe kaguot, wala na jud space for something, and then syempre aircon ang bus, so wala outlet. So wala, feeling na ko may na lang jud kay murag mga after 10 minutes na kaya pag ako ipakam ako ang sarili, after 10 minutes murag nakaabot mi sa Magallanes na ininaog na luwag-luwag ang bus, murag nakaginawa ko kay feeling na ko hapit na gyud ko mag panic attack. So that's a form of anxiety. And then we have the so-called GAD. Kani ang pinakadaghan sa atua, kaning GAD, generalized anxiety disorder. Mao ni siyang anxiety disorder nga naay mga worries, naay mga fears of anything. Walay specific thing ha. Walay specific thing. Dili pareha sa phobia. Actually, phobia is also another type of anxiety disorder. Sa phobia man god, we know unsa imuhang gikahadlukan, so you tend to avoid those things kay syempre nahadlok man ka ato. But for generalized anxiety disorder, na kay anxiety, na kay fear, kana anxiety mo, there is fear, there is worry nga feeling. So over anything about sa imuhang life, bisag kanang natulog na ka, mukalit lang og sagi sa imuhang utok na mahadlok ka mamatay, and then mo na grabe na dayon ang imuhang thinking. So last time sa doctors, I have encountered a student diagnosed with generalized anxiety disorder. So bigla lang to siya ni duol sa ako, isulod siya sa room, tapos ano siya nga, ma'am, pwede ko makig-story sa mga ano siya sa ako. So kung nga naman, so may problema ni mo, ni ano siya nga, makita mo ta ka diri ma'am ka naman, sige lang daw kog ngisi. Ako ha? Buang ko kung sige lang ko og ngisi kung bisag asa ko nimo makita. Nagangisi ko. Ako buang na ko ana ko sa iya ha. Kasi dili man feeling daw niya wala daw koy problema ko. Grabe sa daw wala problema. Uy, wala man siguro tao nga wala problema. Nya dito nag-open up siya na she was diagnosed with generalized anxiety disorder. Bisag unsa na lang iyahang kahadlukan. Usahay sa sulod sa klase, bigla na lang daw ang iyahang utok nga kanang nagalingkod lang man daw siya niya, mukalit lang daw, hala tawagon ko ani sa akong maestra. Unya murag magpanik na siya kadugayan kay nang bisag wagod siya gitanaw sa maestra, di ba? Usayang estudyante pag tanawon ka sa maestra, murag mauna gid na imong hint nga murag tawagon na yung sa imong maestra. Siya bisag wa siya gitanaw, walay mga unsa-unsang nahitabo. Maano sa iyahang isip nga tawagon siya, and then murag magpanic na siya after. So bisag unsa lang kanang padungay na siya matulog, mahadlok siya mamatay, di nang hinuon siya makatulog. Nya usahay maglakaw lang siya sa dalan, mukalit lang og kanang sa iyang utok basig na ay nagasunod sa iyaha. So naanay mga fear dayon na murag ingana mapraning na dayon siya. So the diagnosis is generalized anxiety disorder. So mo na nga word generalized kasi wala mo specific thing na ginakahadlo kaniya. So bisag unsa na lang. So kung unsa iyang mahuna-hunaan, that's it. Okay? And then unlike the post-traumatic stress disorder, gikan diriha obsessive compulsive disorder hangtod sa social anxiety disorder, mga types na sila sa anxiety. So i-include na lang ninyo ang phobia din ha. Kasi si phobia is anxiety gihapon pero alam mo unsa ang imuhang kahadlukan. So sa post-traumatic stress disorder, from the word traumatic, so this one is trauma, especially kanang mga naka-experience o mga bad experiences na traumatic for them. So mag-PTSD na sila, they tend to avoid things nga makapaalala ana sa ilaha, and once nga maalala man gud na nila, so nakakita man mo og kanang naga-PTSD no nga kanang they if they encounter scenario nga makapaalala sa ilahang na experience, there will be flashbacks and then there will be kanang panic attacks. Okay? Yeah, just like sa mga aksidente, kanang mga namolestya, mga rape victims nato, and most of the time naga-PTSD kaning atong mga kanang naka-experience war. So parehas anang atong mga soldiers nga naka-experience og war, so tinuod na siya nga naadjay ma-war freak sa ilaha na kapag kadili na siya ma-process, pwede sila mabuang. Kasi ang PTSD, this is anxiety disorder, nag-flashback na sa ilang utok, and then pwede man gud siya mauwi sa psychosis after. So kailangan gyud siya i-treat. Mo na si Ma'am Lugto, nag-volunteer na actually si Ma'am Lugto sa mga ingana. Katuganing Marawi Sage, na actually nag-volunteer si Ma'am Lugto ato nga isa siya sa mga psychologist na nag-process sa ato ang mga uniformed men nga nakipaglaban ko dito sa Marawi. So isa si Ma'am Lugto ato na nag-process sa ilaha kay syempre naka-experience sila war, and then they have seen the scenario, they have seen their kapwa na mga military, mga soldier nga namatay sa ilahang atubangan. So mo na nga that is traumatic for them. Kailangan sila i-process. Ang mga rapist, sakit ana nila. They are sexually preoccupied na mga tao. Adjay tao nga nay sexual preoccupation. Yeah. Taas ang libido. Pag naakay PTSD, like sa mga soldier, gina-exam na sila kung na sila signs sa PTSD, dili sa sila pwede mo balik og duty. Kasi since they have anxiety, pwede man good na moabot sa harm kung dili sila mabuang. They can either harm themselves or they can harm other people. Okay? Naatay mga class, those are mental disorders also. Sila ng mga tapatibaka i-rape. Na mga na sila, ang tawag nato anak kay sexual disorders. Parehas anang magkaroon lang sila og satisfaction if animals ang ilahang ka-sexual intercourse. We call it zoophilia kasi they love animals. And then you can also hear from the news nga na ay mga nakipag-sex with cadavers. Masahay ka nang nalubong na ilang kutkuton kay i-rape nila ang bangkay. So that is called necrophilia. So they love kanang cadavers. Magkaroon sila og sexual satisfaction. So na siya? Sexual na mental disorder. So apil na din isa na sila ka klase: zoophilia, necrophilia, pedophilia, kanang mga ganahan og bata. mga voyeurism, kanang ma-achieve nila ang sexual satisfaction if magtanaw gani sila class. Mga peeping tom na sila na kanang gusto sila manilip, gusto sila magtanaw porn para ma-satisfy sila. Okay? Wait lang ha. Wait lang. Minom lang ko tubig. Okay? So, asa na ta? Asa na to? Naapoy mga class, sexual disorder pud ng mga fetish, pero dili na sila included diri sa sa mga anxiety disorder kay sexual naman na nga mental disorder. Ang mga fetish ma-satisfy sila sa mga things like mugamit sila o gamit para ma-satisfy sila. Uban mugamit og mga things para ma-satisfy sila, fetish ang tawagan na. Nang mano sa balita you can see nga kanang mga gulay gani na ginagamit nila para ma-satisfy sila. O nga mga tol. Uy, grabe pa ng pinyo. Dako Wait lang. Nakatawa ko. Nakuha mo na mga pipino, mga talong, mga ingana, mga fetish na sila. Amet na jud ay ngan dako makayo and then sakit man tingali na class kay murag hait ba yung pinya no? Nag-viral siya wala wala ko ang pinya iya hanggi like tibuslutan niya or something. So may gani kay katol man na. But anyway, na-satisfy siya sexually. So wala tayong mabuhat ana. Kanaha mga na sila sexual disorders. They need psychotherapy. Okay? They need psychotherapy para matarong sila. Okay, kanang mga split personality lahi na siya ng mga cases, mga multiple dissociative na kanang DID ba na dissociative identity disorder kanang mo split ilahang personality, so usahay duha ka personality, usahay daghan, so multiple personality disorder. Those are actually consequences, for example sa trauma. Ibangan ko kagaina kani anxiety lang ni pag na trauma sila PTSD, pero if dili nato siya matreat ang ilahang PTSD, mahulog siya into psychosis and other mental disorders, apil na din kanang mo dissociate ang ilahang identity na magkaroon ng split personality or multiple personality disorder. So kanang murag itago ba nila ang ilahang na experience, for example it's a painful experience, itago nila na by having another personality man na siya. Wala gibusnot magenda giunsa. Taba.
Ma'am gisulod mami.
Dili ako ma-imagine manggod wala gyud kabaluan na asa man ninyo na ba?
Mami di namin ma-imagine na magkakasya yun doon. Ma'am wala ba yato gipil ma'am? Ay gibalatan niya. Gibalatan niya pala.
Yan no?
Mukas mi sa
Asa
kaya
man ninyo nabasa wala gyud kabasa na.
Mami hindi man yung gibasa ma'am kay nag-trending man to sa Twitter ma'am.
Sa Twitter. Sa Twitter di ay. So I don't use my Twitter that much nowadays. Wala, siguro nga wala ko kabalo. Ang gamit sa akong Twitter, mag-update sa ko ag volleyball niya. Kaya may volleyball karong mga panahon na, so wa siya gamit. So wak kitaan na. Flexible. Okay, so there are people also with social anxiety disorder. So from the name itself, social, may problem sila with their social life. They are afraid of people. They are afraid if they become the center of attraction. So magpanic na sila ana. Mga stage fright nga severe na kaayo, apil na siya din social anxiety disorder. So these people have fear of being rejected or kanang mapahiya sila in front of a lot of people. So they don't really what do you call that? Wala sila nag-socialize kay mahadlok sila. Okay? And then we also have SSRIs that can be used for premenstrual dysphoric disorder. Later, I have a separate slide for this. I will discuss this one and also the bulimia nervosa wherein we use fluoxetine for this. Okay? So what are the adverse effects of our SSRIs? Again, remember na some of the adverse effects of the SSRI are due to their activity to either the muscarinic, alpha adrenergic, and the histamine receptors. So we have here headache, sweating, and then some would experience anxiety due to the increase of usahay serotonin, usahay norepinephrine, and then we have agitation. This one is true mostly for all the drugs. Mostly sa mga drugs, nausea, vomiting, and diarrhea, weakness and fatigue, changes in weight, and then sleep disturbances. So ang uban magsigig katulog, ang uban mag-insomnia. So additional side effects, we have sleep disturbance again, we have paroxetine and fluvoxamine that are more sedating sa mga patient compared to other na mga SSRIs. And most of our antidepressants class really affects the libido of the patient. So there will be sexual dysfunction. If they have increased neurotransmitters, they will have loss of libido, delayed ejaculation, and they will not have orgasm. So we call it anorgasmia. Okay, so this may be due also to their inhibition of the alpha adrenergic receptor. And what is our problem with SSRI? If we give the SSRI to children, especially mga teenagers o mga children, no, they have observed na nagataas ang suicidal ideation sa mga bata pag nagahatag og SSRI. Pero sa mga adults, treatment jud siya for depression so that they will have no suicidal ideation. Ang adverse effect nga suicidal thoughts dito sa mga bata. And then we have seizure sa overdose, kaya remember you will have increased neurotransmitters here. And kapag abrupt ang discontinuation of the drug, the patient may experience discontinuation syndrome. So these drugs require titration of the dose before i-discontinue. Okay, i-gradual decrease ang dose before ka mag-discontinue. Kasi if it's abrupt, then the patient may experience headache, malaise, that's kanang pain sa muscles and a feeling of fatigue. And then we have flu-like symptoms, agitation, irritability, nervousness, and changes in the sleep pattern. Okay? So take note of this. Fluoxetine, sertraline, and fluvoxamine are approved by the FDA para sa mga bata to treat OCD. So na yung mga bata pa sila, they are diagnosed already of having anxiety disorder, specifically the obsessive compulsive disorder, and to stabilize their mood and to stabilize their neurotransmitters, kani ang mga SSRIs na pwede sa ilaha. And for childhood depression, na mga bata class nga, they are depressed. Bata pa lang sila, they already have depression. So ang approved naman natin na SSRI for them are the fluoxetine and the escitalopram. Okay? So I know someone nga nagainom aning escitalopram, naa siya'y depression and naa siya'y anxiety. Nag-abroad siya dati. Tapos, nagkaroon siya, masyag nabuang dito, pero anxiety and depression siya, nakauli siya dinhi nga wala siya dalang laing dala kundi ang iyahang gisuot na lang, kay gitabangan na lang siya sa Filipino community dito, kaya nakita siya nagabaktas-baktas sa dalan. So, until now, nagainom gihapon siya og escitalopram. Okay? But this is approved for children also. Questions about SSRI, class? Wala. So let's have the second group of drugs for our depression. We call them SNRIs, or the serotonin norepinephrine reuptake inhibitors. Again, both serotonin and norepinephrine reuptake inhibitors. The first group of drug is selective for serotonin only, but this time both na. Gina-inhibit na ang reuptake both ni serotonin and norepinephrine. Thus, the result is an increase of these two neurotransmitters. So, when are we going to use the SNRI? Pwede nato siya gamiton if the patient is unresponsive to SSRI. And class, they have found out that antidepressants have an analgesic na activity. That is why SNRI are used now for chronic painful symptoms like backache and muscle ache. Actually, kanang sakit ang likod, pero may sakit ang muscles, that's a sign of depression. So kanang chronic pain, sige na sakit ang likod, depression na siya. So aside sa pag-treat of depression, they have found out na when you increase these neurotransmitters, it will also block pain signals. That is why pwede siya himuong treatment for chronic na mga pains. So what are the examples of our SNRIs? We have the desvenlafaxine, the duloxetine, levomilnacipran, and the venlafaxine, which is more of a serotonin reuptake inhibitor. Ang iyahang activity sa norepinephrine transporter kay medyo weak. Okay? So karong mga panahon na daghan sa ato ang ginasakitan og likod. So this may be due to our position. Like ako, gikan pa 7:30 akong klase, gay na pa kog nilingkod diri. Okay. Muna na siya ang hinungdan karon sa daghan og gisakitan og likod. That is why it is advisable to stretch from time to time. So usay mo na pag mingon kog kaihion mangihi jud ko. So that is my time para mag-stretching na pod. Okay? So muna siya kasagaran sa mga sakit karon. Sige lingkod. Dili parehas tong napatay face to face nga klase kay ako nagasige jud kog tindog. Well, di ko ninyo makitaan maglingkod magmaestra pag face to face. Kay ano ra ba ko laagan ba ako magmaestra pag face to face. Mabot na ko sa likod. At ako sa left, maadto na pag sa right. Karon way exercise. So, sakit sa likod lang yun. Ug sakit sa lubot tinuod. So, mana siya. So, venlafaxine class, these are the side effects or the adverse effects of venlafaxine. Actually, common yun na sa ilahan, no? Siya, headache, and sexual dysfunction is common sa ato ang mga antidepressants. Dizziness, common po na siya. Insomnia, sedation, and constipation because of the activities of the neurotransmitters. So this venlafaxine is just an analog of venlafaxine. So gikuan lang siya og methyl nga group, nakabuo na sila og another drug, and that is this venlafaxine. And duloxetine is a good one. It inhibits both the serotonin and norepinephrine reuptake at all doses. Kasi naay uban nga SNRI nga ang ilahang activity sa serotonin ug sa norepinephrine is dependent sa dose. Kung itaas ang dose, it will be more on the norepinephrine. Kung ibaba, it will be more on serotonin. But this time for duloxetine at all doses, pantay iyahang activity for serotonin and norepinephrine. The adverse effects are the normal side effects nga makita sa mga antidepressants. Okay? And then the last one, we have the levomilnacipran, which is coming from milnacipran, the older SNRI na ginagamit for depression sa Europe. Pero sa US, ang milnacipran is ginagamit for fibromyalgia. So that's muscle pain. Okay? Pero depression ihangga antidepressant siya sa Europe. Now they have made an analog of milnacipran, enantiomer levo. So this one is an optically active drug already, and it can rotate the light to the left. So that is why levo milnacipran. So questions about our SNRI. So mas madali class studyhan ang ato antidepressants pagkabalo mo unsang grupo sila na belong. Kasi ang pangalan sa ilang grupo will give you a hint kung unsa ilahang mechanism of action. Questions? Wala. So let's have the atypical antidepressants. When you say atypical antidepressants, we cannot group them as either SSRI or SNRI or even a MAO inhibitor. Dili na to sila maggrupo din ha. So, gigroup na lang sila into one, but we call them atypical antidepressants. So, this is due to their mechanism of action. Dili lang, ang ilang mechanism of action kay dili man good nag-concentrate sa serotonin lang o kaya sa serotonin ug sa norepinephrine. So, daghan siya og mga receptors involved. That is why atypical antidepressants ang tawag sa ilaha. So we have here bupropion, mirtazapine, nefazodone, trazodone, vilazodone, and vertiosepine. Ang inyong tandaan class, si bupropion and si mirtazapine, mauna silang duha ang atuang antidepressants na ginagamit if we want the person nga dili maka-experience og sexual dysfunction. Kasi mauni ang antidepressant na walay adverse effect on the sexual function of the patient. Okay? So for example, nag-SSRI ang ato ang patient tapos nag-experience na siya og sexual dysfunction. Gina-shift na sa doctor yung tambal either sa bupropion or sa mirtazapine. Okay? So we will discuss them one by one since dili na to pwede i-generalize ang ilahang mechanism of actions. So let's start with the bupropion class. Si bupropion is a weak dopamine and norepinephrine reuptake inhibitor. So duha ha, dopamine and norepinephrine reuptake inhibitor. So we don't have the serotonin here. So para asa si bupropion, aside syempre from being an antidepressant and wala siya adverse effect on the sexual dysfunction, ginagamit siya for smoking cessation. So studies showed na if you give bupropion to patient, it can mimic the activity of nicotine in the body. So pwede siya gamiton as an alternative so that the person can cease smoking. It can decrease the craving. At the same time, it can decrease the withdrawal symptoms of the patient since it will mimic the activity of nicotine sa body. However, the patient may experience dry mouth, sweating, nervousness, tremor, and dose-dependent increased risk for seizure. So this one is contraindicated for seizures class, ang bupropion, kasi nga isa sa adverse effect niya, especially if masobraan na ma-overdose ang patient kay seizure. And we cannot give bupropion for patients with eating disorders, especially bulimia. So we'll have a separate discussion sa bulimia later ha. And then we have the mirtazapine. Sorry, it's mirtazapine. So this time, what will be the mechanism of action of mirtazapine? Its activity is on serotonin and norepinephrine neurotransmission by serving as an antagonist to the presynaptic alpha-2 receptor, and then antagonist pa dyan siya sa 5-HT2 receptors or the serotonin 2 receptor. So pwede niya class i-enhance ang pagdaghan sa serotonin and the norepinephrine also, pero its action is more on the alpha 2 receptor. Remember, alpha 2 class, it's presynaptic, and then if ma-stimulate man gud si alpha 2, it will inhibit further release of norepinephrine. That is why if we use mirtazapine, inhibit niya ng alpha 2 receptor para wala na say mag-inhibit sa further release ni norepinephrine. Ang ending, mudaghan ang norepinephrine. And then antagonist siya sa serotonin 2 receptor. So, basig matingala mo, kaya di ba ang goal for depression is to increase the activity of serotonin. So nganong antagonist siya? Si serotonin, daghan siya gamit sa body. Depende siya sa iyahang receptor. And si serotonin na siya isa ka receptor which is the 5-HT2 receptor nga pagka na ang ma-activate ni serotonin, it will lead to hallucination, it will lead to depression and anxiety. That is why pwede na to siya i-inhibit so that the person may not experience those things. However, since mirtazapine can also inhibit the histamine receptor, this is markedly sedating. Makatulog ang patient ani pagka niyang iyahang tambal, and it can also cause weight gain because of the accumulation of fats. And then we have the nefazodone and trazodone. Ang inyuhang tandaan klase, nefazodone ug si trazodone are both 5-HT2A receptor antagonist. Okay? Na-remember ninyo, ingon ko bago lang yun from the previous slide. Pag 5-HT2 receptor, that's the receptor of serotonin, na when being stimulated, it will lead to depression, anxiety, and hallucination. So, paano na nila nabalaan nga mag-cause siya hallucination? When they studied the effect of LSD, the lysergic acid diethylamide, and the mescaline, kanang peyote na mushroom nga naga-cause og hallucination, they found out na naga-cause day katong duha og hallucination due to their interactions sa 5-HT2A receptor. And mo na ang pagka-discover nga kana siya ang receptor nga lahi og effect sa all other receptors of serotonin. Okay? So tanan drugs class na naay action on the histamine receptor can be sedating. Okay, so naay orthostasis and dizziness, especially because it can also block the alpha receptor. So those are our problems with antidepressants because they can be antihistamines also, they can be antimuscarinic also, and they can be an antagonist sa alpha receptor. Let's just have additional adverse effects of the two drugs. For trazodone, it can cause priapism. Are you familiar with priapism, class? Isang condition ng priapism? Any idea? Wala.
Ano, ma'am? Prolonged erection of the penis.
Yeah, very good. When you say priapism, it's prolonged erection of the penis. Usahay kay mag more than 24 hours sila nga nag-erect. Nang anong adverse effect na ha, meaning that's a disorder. Walay lalaki nga gusto mag 24 hours naka-erect ang iyahang reproductive organ. Okay? Taman rin na sa utok class nga gusto nila dugay, mag-erect. Pero walay lalaki nga gusto more than 24 hours naga-erect ang ilahang penis. Nga naman, number 1, pag prolonged ang erection sa lalaki, that will be very painful for them. Number 2, dili sila makaihi. Nakuha? Kung tanan ninyo ang lalaki, maglisod na sila pangihi pag naga-erect ang ilaha. So, ang pangutana, makapatay Ni sa mga lalaki, yes, makapatay. Muna sa makulbaan ko anong mga advertisement sa kanabitong Drive Max sa pana robust mga ingana na mga products. So sa makulbaan ko ako yawan nila kay ang advertisement ba ko kanang exaggerated gani kayo. Makaingon na lang kung kinsa mang lalaki gusto makaingon ana be nga sobra 24 hours they are very active wala pahuway ang ilahang penis no, that will be very painful for them. Sakit kay na unya for the whole 24 hours di sila mangihi. Makaihilang na sila class pag mawala na ang erection. Pangutanan ninyo kung namoy mapangutanan nga lalaki. We call that priapism. The condition is called priapism. And for nefazodone, we have hepatotoxicity. So, magtuuan ng mga drive max kung mga sa unsa pa nang gina-promise nila. Remember, those are food supplements only, meaning no approved therapeutic claim. And then we have here the vilazodone, which is a serotonin reuptake inhibitor at the same time a partial agonist. Agonist had this time, it's 5-HT1A. It's no longer 5-HT2, it's 5-HT1A. So this is another serotonin receptor. So vilazodone is a partial agonist. So it can activate the receptor just like the serotonin pero partial lang. Adverse effects similar to SSRIs since this can also be antihistamine, antimuscarinic, and alpha-adrenergic antagonist. So including the discontinuation syndrome. And then the vortioxetine, daghan siya og mechanism of action. So pwede siya inhibition of the serotonin reuptake. At the same time, agonist pa jud siya sa different kinds of serotonin receptors, and pwede po siya antagonist sa uban nga serotonin receptors. When we have our discussion sa serotonin, because that's another chapter, I'll be discussing sa inyo the different types of serotonin receptors. Daghan kayo na sila and dahilahi sila og activity. Okay? But for the activity of serotonin in the brain, para sa depression, we need the 5-HT1A. Okay? So, kanina, adverse effect, this is common sa mga drugs. So, those are our atypical antidepressants. Again, we call them atypical because we cannot generalize their mechanism of action. They bind to different receptors in the body. So, they have different types of mechanisms of action. Questions so far? Before mag-continue with our oldest antidepressants, the tricyclic antidepressants. Wala? So let's take a break first 5 minutes. Mangihi lang, stretching, inom tubig, and everything. So we ended with vortioxetine. So let's continue with another group. This one is the fourth group of antidepressants. And these are actually the oldest antidepressants we have. The tricyclic antidepressants. However, they are the oldest, but their use now is being superseded by the SSRI and the SNRI. This is because mas grabe ang adverse effects ni TCA compared with the two, and mas matolerate sa mga patients ang SSRI and SNRI compared to this. So, ato ang tricyclic antidepressants, we have two subgroups, the tertiary amines and the secondary amines. Sa tertiary amines, we have the first drug, which is the imipramine. I believe na-encounter ninyo siya sa anticholinergic na to nga discussion, since imipramine can also be used for enuresis, that's bedwetting in children. And then we have the amitriptyline, trimipramine, clomipramine, which is a drug used also for OCD, and then doxepin, and for the secondary amines, we have the disipramine and the nortriptyline. So be familiar with them. All of them belongs to belong to tricyclic antidepressants. And then actually we have tetracyclic. So from the name itself, tricyclic, meaning their structure has structures have three aromatic rings, while this one tetracyclic, meron silang apat. So we have the mapropylene and the amoxapine. Now, what is the mechanism of action of our tricyclic antidepressants? Actually, si tricyclic antidepressant parehas kay SNRI. They are serotonin and norepinephrine reuptake inhibitors. Parehas sila ha, parehas sila sa SNRI o mechanism of action. However, they are not, I mean, they are different when it comes to their structure and especially to their adverse effects. So, manailahang kalahian. Now, just like SSRI, aside sa serotonergic ni siya, they are also active sa pag-block sa mga alpha receptors, histamine receptors, and muscarinic receptors. However, ang adverse effects na ginakos ani nila is much more severe compared to SSRI. For mapropylene and disipramine, they are relatively selective inhibitors of norepinephrine reuptake. So, di ba kay ano sila, serotonin and norepinephrine reuptake inhibitor, but these two has more affinity to the NET compared, net sila kaysa sa SERT. SERT ang sa serotonin. And then amoxapine, aside sa it can block this receptor, remember this is the receptor that can cause anxiety, depression, and hallucination for serotonin. So it can block these receptors also. Amoxapine can also block the dopamine receptors. Okay, so mga additional activities lang na nila. So what are the actions of our tricyclic antidepressants? They can elevate the mood of the patient with depression. Pero actually, kaning nakabutang diri nga requires 2 weeks or longer of therapy. This is actually true for most of the antidepressants. Dili pwede class nga nag-depression ng patient tapos 1 week lang siya mag-inom. Most of our antidepressants requires 2 weeks or longer before mag-take of action, before maka-elevate sa mood sa patient. Kasi ang when you read the book, ang explanation nila, magkaroon og action ang atong mga antidepressants sa neurotransmitters ug sa BDNF factor katong brain-derived na neurotrophic factor, magkaroon siyang effect at least 2 weeks pa. Mapadaghan to niya nga factor after 2 weeks pa. So dili pwede nga 1 week lang mo inom ato ang patient sa mga antidepressants. So pag mapataas na to niya mga factors na to, at the same time ang mga neurotransmitters, then there will be elevation of mood, there will be improvement sa mental alertness and physical activity of the patient. And it can reduce morbid preoccupation in 50% to 70% of individuals with major depression. So, mani ang action sa ato ang tricyclic antidepressants. So, para asa sila? Syempre sa depression. It can be given to either moderate to severe depression. Pag mild lang ang depression sa patient class, psychotherapy is enough. And then we have panic disorders. So you can also use this for anxiety disorders. And at the same time, ang mga antidepressants dyan na well-known na treatment for chronic pains kay ato ang mga TCAs, mga tricyclic antidepressants. So they are observed to be analgesics also due to their action sa pag-increase sa mga neurotransmitters. So that is why when we will talk about migraines, you will also encounter amitriptyline for migraine headache and mga chronic pain na mga syndromes. And doxepin is the most sedating among them. That is why it can be used for people with insomnia, mga dili katulog, especially sa gabi. Karang insomnia class, dili lang na siya sa dili katulog ha. Insomnia po ang tawag class kapag ka nakatulog na ka pero masigi kag mata-mata. Ganing disturbed ang imuhang sleep. Insomnia gihapon na siya. Okay? So, kanina mention na nako ni that imipramine is our drug of choice for enuresis in children. That's bedwetting. So, ginagamit siya to control bedwetting in children older than 6 years of age. And this is due to the action of imipramine to the muscarinic receptor. So, again, it can block the muscarinic receptor. So, we have to reverse the dumbbell. Diba? U is urination, but the reverse of that is urinary retention. Okay? So adverse effects, mao niya akong ginaingon nga the list of the adverse effects of the tricyclic antidepressant is very long, and this is now the reason why mas ginagamit na si SSRI compared sa ilaha. So, depende sa ilahang actions on the different receptors. So, just like when they are able to block the muscarinic receptors, the patient can experience the following signs and symptoms. So, there will be blurred vision. Serostomia is, dry mouth. Again, serostomia is dry mouth. And then there will be urinary retention, sinus tachycardia. You just have to reverse the dumbbells. B is bradycardia. So the reverse of that is tachycardia. So this one, constipation, the reverse of diarrhea. And aggravation of angle closure glaucoma because of the mydriasis effect of the anti-muscarinic activity. And then, it will lead to tachycardia, remember? So that will be arrhythmia, and it can be life-threatening, especially if the patient is overdosed with the TCA. And ang mga SSRI are much safer compared aning TCAs na ni. Kasi pag TCAs plus pag ma-overdose ang patient, pwede dyan siya mauwi sa death. Ang SSRI do, pwede po siya mauwi sa death, pero ang incidence is not that high compared to TCAs. And then, since it is able to block also the alpha-adrenergic receptors, then the patient may experience the following also: orthostatic hypotension, dizziness, and reflex tachycardia. And the sedation, this is for the antihistamine jud na activity. Aside from that, we have weight gain and naagihapon na si sexual dysfunction. So medyo taas or medyo daghan ang adverse effects ni TCA. Mauna nga gi-reserve na lang nato class si tricyclic antidepressant as treatment for depression kapag dili na responsive ang mga patient to either the SSRI or the SNRI. Okay? So do not forget also that TCAs should be used with caution in patient with bipolar disorder. Nga naman, dako ang incidence class nga pag ang patient is diagnosed with bipolar disorder tapos naa siya sa iyahang depressive na phase, tapos gitagaan nato siya og TCA, mupaspas ang pag-switch sa iyahang phase dito sa manic nga behavior. So mag-experience na noon og mania ang patient, kay gitambalan man nato ang iyahang depressive nga phase, mo shift siya padulong sa mania. And then remember that mania is one type of psychosis. Okay? Questions about the tricyclic antidepressants? Daghan na mo og tambal nga kailangan maila-ila. Wala'y pangutana. So mag-move on na ta. I think this will be the last group of drugs for depression. We have the monoamine oxidase inhibitors. So remember the MAO, it's the enzyme that will degrade our monoamines or our catechol amines. So natay two types of MAO, the MAO A and the MAO B. MAO A can degrade the serotonin, the norepinephrine, and even the epinephrine. And the MAO B, though it can also degrade the serotonin, but its action is more on the dopamine. So, moto nga sa Parkinson's disease, ang atong mga MAO inhibitors dito are selective for the MAO type B. So this time, naapod tayo MAO inhibitors nga para sa depression. So pag i-inhibit nato ni na enzyme, it means ma-inhibit ang enzyme na mag-degrade ani atong monoamines and wala na sila, so mutaas ang level sa mga neurotransmitters in the body that will be helpful for patients na naay depression. So unsa ni sila ang mga MAO inhibitors nato na helpful for depression? We have phenelzine, tranylcypromine, mga brand names na nila ha, and the isocarboxacid. And actually, selegiline is used for Parkinson's disease. That is why, di ba, na-encounter nato siya sa previous na chapter. Ginagamit siya sa Parkinson's disease. Pero pwede po siya gamiton for depression. And actually, this is the only antidepressant available in transdermal. This is transdermal. So transdermal patch or transdermal delivery system. So both si selegiline for Parkinson's and depression. But kani silang tatlo, phenelzine, tranylcypromine, and isocarboxacid, they are for depression only. We cannot use this for dopamine because ang ilahang action is mostly on the MAO type A. Okay? Ang kailangan nato sa Parkinson's katong action sa MAO type B. Excuse me, daghan acid ako ang tiyan. Sikog tugab. Questions so far about the MAO inhibitors? Siyempre, ang mechanism of action nila, they will inhibit the MAO so that there will be increased norepinephrine, serotonin, and even the dopamine. So, para asa sila class, ginagamit nato sila for depressed patient na dili na responsive sa SSRIs or even sa TCAs. Meaning, di ba, ang TCA, gina-reserve lang nato kung dili na effective sa SSRI o sa SNRI. So, karon kung dili na sa defective ang patient, both sa SRIs and sa PCAs, then we have the MAO. Okay? And ginagamit po nato ni for patients with anxiety. Kasi usahay mag-double ang patient na anay depression, naapag yung anxiety. That is, very difficult for them. Na sila depression, naapay anxiety. So, ginagamit siya for atypical depression. Okay? So, take note of this because this is very important as a pharmacist and as a physician also. So, when you switch antidepressant agents, you should have a minimum of 2 weeks of delay na i-allow after termination of MAOI therapy and initiation of another antidepressant from any other class. So example, ang imuhang patient is naga-MAO inhibitor treatment siya sa depression. Nagusto sa doktor nga ilisan ang tambal sa patient kaya wala na siya nag-response sa MAO inhibitors. So kailangan nato tandaan nga undangon niya ang iyang MAOI inhibitor and then tagaan og 2 weeks nga pahuway before sugdan ang new drug. Actually, that is true for other antidepressants also. The reason for this is to avoid the serotonin syndrome. Kasi magstay pa manggod ang sa body ang ato ang mga ang first drug niya and then masundan og another drug, ang mahitabuan na daghan kaayo na ang serotonin sa body sa patient. So that is also true for the SSRIs, especially the fluoxetine. Kasi si fluoxetine is naana siya metabolite called norfloxetine nga dugay kaayo magstay sa body. So pag fluoxetine ang tambal sa patient tapos i-switch siya sa another drug, ang iyaha jud kay at least 4 weeks. So pahuway sa siya at least a month sa iyahang antidepressant drug before siya mo switch sa another drug. Para dili sila magsabay sa body sa patient and magsabay ang ilahang mechanism of action, mudaghan kaayo ilahang serotonin leading to serotonin syndrome. So kanang serotonin syndrome class, it's a condition of a patient having too much serotonin in the body, and the signs and symptoms include both physical and mental and emotional na mga signs and symptoms. So sa physical, like there will be nausea and vomiting, na ay mga diarrhea, mga ingana na mga cases, physical. Pero sa emotional na state, mag-anxiety na ang patient ani, there will be confusion, there will be hallucination, magsagol-sagol na ang tanang effects ni serotonin. We call it serotonin syndrome. So what are the adverse effects of our MAO inhibitors? There will be drowsiness, there will be orthostatic, hypotension, blurred vision, dry mouth, and constipation. So, again, dili pwede isabay si MAO inhibitors, parehas atong MAO inhibitor sa Parkinson's disease, dili sila pwede isabay sa tyramine-rich foods because they can cause hypertensive crisis. Ibig sabihin sa hypertensive crisis, ang BP sa patient ani more than 180 over more than 125. So, nga nakataas ang BP, kay tyramine can cause release of norepinephrine, tapos gi-inhibit pa jud nimo ang MAO na mag-degrade sa norepinephrine. So mudaghan kaayo class ang norepinephrine in the body, leading to hypertension. So muna siya hypertensive crisis. And you don't give MAOIs with other antidepressants, especially SSRIs, because you will also have too much serotonin in the body, leading to serotonin syndrome. Okay? Questions? Kaya pa? Or overload? Hapit na tamahuman, class. Char. Hapit na tamahuman. Yung mahuman ta, magsugod tag another chapter. Okay. So let's move on sa treatment of mania in bipolar disorder. Pero actually, we will have more of this sa psychosis na part. Kasi mania is a psychotic behavior. So, ma-discuss lang siya sa bipolar disorder kasi remember, bipolar disorders have two phases, the depressive na phase and the mania na phase. Okay? So, sa depressive na phase sa patient, syempre, antidepressant ang atong ihatag. But for manic phase class, this is a board exam question, the drug of choice for mania in bipolar disorder is lithium. Though until now, the mechanism of action is still unknown. Pero drug of choice dun na si lithium, especially the lithium carbonate. Okay? We have brand names in the market like Helonium R and Escalith. Okay? Ginagamit siya either acutely and for prophylaxis sa pag-manage sa bipolar disorder. So for example, naga-antidepressant ang ato ang patient na bipolar. So para dili siya mo switch into the manic phase, ginahatag ni siya as prophylaxis also. Okay? So pwede siya gamiton in treating patients exhibiting mania and also hypomania. So mania is most likely depressive na phase niya. Okay? But ang problem nato with lithium is this is very toxic. This is poisonous. And when you look at its therapeutic index, the ratio between its effective dose and toxic dose, it's very low. It's extremely low na double dose of this can cause toxicity already. So what will be the toxicity of our lithium? So we have headache, dry mouth, polydipsia. What is polydipsia? Excessive na thirst. Excessive na thirst. Sige, uhaw. Patient nga naga-experience o toxicity sa lithium. Sige uhaw, polyuria, syempre sige ihi. Sige mag-uhaw, so sige ihi. And polyphagia is extreme hunger. So sige ihi, sige uhaw o sige pod siya kagutom. And GI distress, that is why you have to give lithium with food. So this is an example of a drug na kailangan na ay food kasabay. And then there will be fine hand tremor, magkurog ang kamot, dizziness, fatigue, dermatologic reactions, and sedation. So our problem with lithium is overdose. Kapag higher na ang plasma levels, So, aside from those nga na-mention sa taas, pwede maapektuhan pwede magkaroon ng patient og ataxia. Ataxia class is uncoordinated muscle movement. So, wala na coordination imuhang mga muscle movement. So, pwede na sila na yung mga muscle jerkings and all other stuffs na dili na nimo makontrol and dili na ma-coordinate imuhang muscle movement. And then there will be slurred speech, and then fine tremors lang ning naa sa common yung adverse effects, pero pag too much na ang overdose, we have coarse tremors, confusions, and mauwi siya sa convulsion. So again, lithium is very toxic. So other drugs class nga ginagamit for mania in bipolar disorders include anti-epileptic drugs. So mo nitong pangutan na kagainan ni Isobel nga pwede ba isabay ang antidepressant ug anti-epileptic drugs? Yes, pwede sila isabay if the patient has bipolar disorder. So, ang mga anti-epileptic drugs lang ginagamit sila as mood stabilizers para dili sila magsigig bahis-bahis sa depressive nga phase o sa mania nga phase. So, example sa mga anti-epileptic drugs nga pwede sa bipolar disorders, we have the carbamazepine. Brand name ani sa market is Tegretol. And then we have valproic acid, the Depakote and the Depakin mo na ang brand names niya. Let me write its screen. So for carbamazepine first, Mazepine, our brand name na common sa market is Tegretol. For valproic acid, it can be either Depakote or Depakin. Dahil lang ni silag salts. Naka-sodium lang ng isa, sodium valproate. Okay? And then we have the lamotrigine. So I'm not very familiar with the brand name sa lamotrigine sa market. Okay, and aside from anti-epileptic drugs na pwede gamiton sa mood stabilizers and pag-manage sa mania, you can also give the antipsychotic drugs, either the old or the new na mga antipsychotic drugs. When you say older, we have the chlorpromazine and the haloperidol, and then we have newer antipsychotic drugs also. That will be our next chapter for PCOL. And then, mga atypical antipsychotics. Pag moingon gani kag atypical antipsychotics, mo ni ang mga new drugs nga para sa psychosis. Mo ni ang mga examples sa mga newer drugs nato for psychosis: risperidone, olanzapine, ziprasidone, aripiprazole, asenapine, and quetiapine. So daghan tag drugs for mania. Again, pwede anti-epileptic drugs, pwede lithium ang drug of choice. But you can also use the antipsychotic drugs. Okay? And for bipolar depression, you can either use syempre the antipsychotics gihapon like quetiapine and lurasidone, and pwede nimo i-combine imong antipsychotics ug ang imuhang antidepressants for bipolar depression. Questions, class? So far, wala na? Anything that you want to clarify about depression and all our antidepressant drugs? Before i-wrap up lang nako ha ang gamit sa mga antidepressants. So, syempre again, para sila sa depression. So, especially for acute episodes of major depressive disorder. Kasi ang major depressive disorder, pag dili siya i-treat, mahimog depress ang patient for at least 6 months to 14 months. And pwede pagyud pa ma-prolong up to 2 years or longer if untreated. So, grabe, sa tibuok tuig, sa tibuok duha ka tuig, depressed ang patient. So, ang treatment ani, we will give them for 8 to 12 weeks, we will give them our antidepressant drugs. Most of the time, our first line is the SSRI or pwede po SNRI. But if we cannot achieve an adequate response, meaning na may response pero wala jud na ayo ang patient. So by that time, we can either switch our drug. Do not remember before switching, we need at least 2 weeks before the next drug na ma-start. So we can either switch to tricyclic antidepressants or the MAO inhibitors, or we can just add another agent. So aside from the SSRI and SNRI, we can add either bupropion or mirtazapine, and i-continue na siya sa pag-inom sa patient for half or at least a whole year. Magsige siya inom ng iyahang antidepressants. So that's how you give the antidepressants to patients with depression. And do not forget that since when you have anxiety, you have low levels of serotonin, then atong mga serotonergic na antidepressants can be also used for different types of anxiety disorders like panic, the generalized anxiety disorder, and we have the obsessive compulsive disorders in which we can use either the clomipramine. Clomipramine is a TCA, a tricyclic antidepressant, and pwede po SSRIs. Then we also have social anxiety disorders, and for PTSD, our first line drug is the SSRI. Okay? And then, again, they have found out also again na ang atoang mga antidepressant drugs are analgesics also, so thus we can use them for chronic pain. Okay, kay pag gi-block ang reuptake ni norepinephrine ug ni serotonin, naa siya activity on the pain signals. So especially the TCAs. Ang TCAs jud ang well-known nga ginagamit for pain disorders. Though duloxetine, which is an SNRI, it's the first antidepressant na na-approve sa FDA as treatment for diabetic neuropathy na pain and fibromyalgia. Sakit na muscles. And sa diabetic neuropathy, since ano na siya, complications sa diabetes, since namatay yung mga nerve cells na natabunan na sa mga daghang sugar, they will experience pain. Diabetic neuropathy atong tawagan. Okay? Questions? Wala? So, ang ato sa bamong iro plastic ta. O concentrate. Okay, let's continue. Aside from those things, you can also give the antidepressant drugs for premenstrual dysphoric disorder. This is common to women. Siyempre, women, no, kaya wala man naga-menstruation ng mga lalaki. This is common to women, especially during kanang birth, kanang pregnancy age, kanang age na to where we can be pregnant, kana ng mga age. When you say premenstrual dysphoric disorder, ma-experience ni siya sa babae on the late stage or the late phase sa iyahang menstrual cycle. So when you say late phase of the menstrual cycle, dito na siya kanang before mugawas ang menstruation. So like a week before or 2 weeks before, mostly week before the menstruation, ma-experience ni siya sa babae. Pwede maapektuhan iyahang mood and naa siya mga physical symptoms nga ma-experience. So sa mood class, the woman can have anxiety and pwede kasi na yung mahitabo na mga hormonal changes before ka mag-menstruation. So that is why there will be anxiety, there will be depressed mood, irritability, insomnia. Before ka mag-menstruation, mag-insomnia, there will be fatigue and variety of physical symptoms. When you say physical symptoms, included din ang kanang sakit ang puson, sakit ang kaning diri sa likod dapit, sakit ang breast, kanang mga pasa-pasa, apil na siya. Kaya lang, let's differentiate this sa PMS. Kasi PMS is premenstrual syndrome. And ang mga signs and symptoms sa premenstrual syndrome parehas lang sa PDD or premenstrual dysphoric disorder. Kaya lang grabe lang gyud ang sa PDD kanang dili na gyud mahimong functional ang babae ani before siya mag menstruation. Appeal na siya. Gawas ang pimples, appeal na siya. Kasi that's the effect of the hormones. So kung naanay mga effects sa mood class, that's the time we give antidepressants, especially SSRI, fluoxetine, and sertraline. Okay? Pero common na siya sa babae class, effect din na siya sa hormones before ka mag-menstruation at the late luteal phase sa imuhang cycle, 1 week before your menstruation, you will really experience different kinds of mga mood and physical symptoms. Muna mabugahay nagkalayo. And there will be anxiety or ang uban ma-depressed na. Muna usahay class 1 week before your menstruation. Usahay na ay cry spells. Crying spells nga kalit na kagkahilakpon, wa man ta kay problema na depressed ka og kalit. Common na siya sa babae. Okay? So, pwede na siya PMS lang ha, premenstrual syndrome lang atong tawagan na. Pero pag severe na, mahimo na siya premenstrual dysphoric disorder. Mahimo na siyang disorder class kay it can affect na the day-to-day life of our patient. And then, na-mention ako, bupropion can be used for smoking cessation since it can mimic the nicotine's effect sa dopamine and norepinephrine and ma-antagonize niya ang nicotinic receptor. And the eating disorders, remember bulimia nervosa? Bulimia nervosa is when the patient is always eating, naga-binge eating siya. Actually, it's binge and purge cycle. Meaning, magsige siya kaon, tapos there will be purging. So, iyahang i-induce ang pagsuka or mogamit siya o mga laxative kay na dili siya gusto mo tambok or other methods basta lang kay ma-feel niya nga nagawas niya itong mga iyahang mga ginapangkaon. So unsa ang kamatayan sa patient na hypokalemia due to emesis or kanang catharsis siya kalibang and kani sa esophagus pwede masamad. So naata fluoxetine can inhibit that anxiety nga pag-anxiety man gud na siya nga sige siya kaon nga pagkahuman na murag naa gani feeling of guilt nga manambok na ko ani kanay sige pagkaon. Pero fluoxetine can be used only for bulimia nervosa but not with anorexia. Kasi si anorexia is anxiety gihapon, eating disorder gihapon, pero dili jud siya mukaon. Di siya mukaon kay mahadlok man siya motambok. So payat kay sila. You cannot give fluoxetine there. For people with anorexia, psychotherapy only, family support, and kanang syempre pakanon. Ang nutrition niya ibalik para motaba-taba siya ulit. Okay? And syempre urinary incontinence and enuresis, especially sa PCA. So we have the imipramine and actually the loxapine now is also being studied for urinary incontinence or enuresis. So that's all for the uses of our antidepressants. Concerns, questions, clarifications about chapter 10? Wala. So we will have our quiz about activity 10 on Monday next week. And then naanapod ko yung reading assignment sa inyo ha. The reading assignment is the next lesson will be about psychosis. Therefore, you read anything about psychosis, the signs and symptoms, what else? The pathophysiology of psychosis and what happened to the person with psychosis. And maybe you can start reading about drugs na ginagamit na to for psychosis. Ito lang.